All right, welcome everybody. Good morning. How's everybody doing this morning? Good morning. My name's Dave Thompson. I'm the director of the wellness program, and I'm so happy you all could make some time to be with us this morning. Long story how we got to this point. First I'll start with what this is. This is an event we call the Resolution Revolution, and the idea behind that was that it was going to be a January event, supposedly early around the time people were making their New Year's resolutions, but scheduling being what it is, it didn't work out that way this year. But you know what? It's never too late to make a new start and to get off on the right foot. So we hope that this is going to be motivational. I'm sure it will be, that you can get off on the right foot on your nutrition for this year. I'd like to think of the wellness program as a collaboration, and by that I mean, we listen to you. I get a lot of ideas coming my way, and I thank you for that. Primarily, we get ideas generated out of the Wellness Committee. And so many of you have served on the committee, and the college has been the beneficiary of that. And the idea for this event came directly from the Wellness Committee. Over a year ago, we were sitting around talking about ideas for the next Resolution Revolution, and Joan Kane was on the committee at the time and said, I just saw this great podcast. I saw this doctor giving a talk, and she was terrific, and maybe it's someone we should think about getting. And so I wrote the name down and followed up a bit. And over 100 emails later, back and forth, trying to work schedules. Doctors are busy. This particular doctor is very busy. So we're very lucky to have her up here today. And right down to the wire, where last night, of course, when she got to Newark Airport, the flight was canceled. She got on standby another flight, couldn't get on the flight, got on a bus, went to LaGuardia, got ready to get on Delta. All Delta flights were canceled due to an IT glitch, and it didn't look like it was happening. But thanks to her persistence and a little bit of luck, she got in late last night and was able to be here this morning. So, in thanks to Joan Kane, who was the catalyst for this event, I want to bring Joan up to do the formal introduction.
Good morning. Michelle McMacken, MD, is a board-certified internal medicine physician and assistant professor of medicine at NYU School of Medicine. An honors graduate of Yale University and Columbia University College of Physicians and Surgeons, she practices primary care, directs a weight management program, and teaches doctors in training at Bellevue Hospital Center in New York City. Dr. McMacken is an enthusiastic supporter of plant-based nutrition and is committed to educating patients, doctors, and the public about the power of healthy eating and lifestyle modification. She has received the Faculty Teacher of the Year Award 3 times and has been featured on several documentaries, in national academic nutrition conferences, and on popular nutrition-related websites and podcasts. Dr. McMacken is also a council member for the True Health Initiative, a coalition of health experts from around the world committed to educating on evidence-based, proven principles of lifestyle as medicine. Welcome, Dr. McMacken.
Thank you so much, David and Joan. And I can't tell you how excited I am to be here. As you can see, I'm pretty persistent. Yesterday I thought, we've been planning this for a year, and I'm so excited about it. There is no way I'm not coming to Hamilton, so I'm thrilled to be here, and thank you guys so much for coming. I'm going to be talking to you today about a concept called food as medicine, and specifically 7 things that happen when you change what you eat. Now, what a vague title, right? Change what you eat. What does that even mean? So I'm going to get into that, starting with a confession. So this is a picture of me on my graduation day from medical school with my mom and my grandma. And I think I got a great medical education. I'm very proud of the education that I got. But one thing I was never taught about was nutrition. And sadly, that's still the case for most of the medical students and the medical schools in this country. Doctors are just not taught really that much about nutrition. And it's ironic because when you look at the 10 leading causes of death in the United States, most of them are directly related to our food choices, including heart disease, our #1 killer, cancer, our second killer. These are all directly related to our food choices, and that's very underappreciated in the medical community. Believe it or not, we now know that our dietary choices are responsible for more chronic disease death than smoking. Think about that. I was shocked when this study was published. You can see that a poor diet dominates everything else we do. And it's not to say that a pack of cigarettes is better for you than a hamburger. But it is to say that poor dietary choices are so common that they're really driving the epidemic of chronic disease and chronic disease death. For the first 10 or so years of my practice, I had a very traditional practice. And what that looks like, and I'm sure many of you are familiar with, a patient would come into my office. I would do some blood work, check a blood pressure, and I would say, "Oh, I'm very sorry, Mr. Jones, you have high blood pressure and you have high cholesterol. I'm going to start you on a medication for your blood pressure and a medication for your cholesterol. See you in a few months. Good luck." And it started to occur to me as I learned more and more about nutrition that the way I was practicing was similar to this picture. What I was doing was sort of, you have an overflowing sink, and you're taking your mop and you're mopping up the floor, but you're never really reaching up to turn off the faucet. So with my pills and with the procedures that I was recommending, I was treating symptoms, but I wasn't really helping my patients get to the root cause of their disease. So I had a little epiphany and I said, you know what, I'm going to try using lifestyle. I'm going to try talking to my patients about what they're eating and how they're living their lives and see if maybe I can reduce their pill burden, see if I can prevent them from going on medications. One little problem, I had never learned anything about nutrition. So what I did was I got a grant to actually study nutrition and look at what the evidence shows we should be eating. And part of the requirement of that grant was that I actually had to develop a program to teach other doctors about nutrition. So for the past year, I have been teaching what I learned to my colleagues, both the faculty and the resident, the doctors in training, and the medical students. It's been one of the most rewarding things that I've done in my career. So, nutrition tends to be a pretty hard thing to study, and it can be confusing, right? I think that we have all seen headlines where, one day we hear cholesterol is bad for you, the next day we hear butter's fine, then we hear bacon causes cancer, and it's really hard to know what to believe, especially when major studies get published and they get filtered through popular headlines. So, believe it or not, there is actually a broad consensus among nutrition scientists, people who've spent their lives looking at what's healthful and what's harmful for us. There's a broad consensus around what we should be eating. And you can think of that consensus in this framework. I'll walk you through it. So you can think of food as occurring in 3 different categories or boxes. Let's start with these green box foods here. These are considered healthful foods. Whole grains, legumes, which are beans, lentils, chickpeas, peas, fruits and vegetables, nuts and seeds. There is broad consensus that these foods are healthy for us. And the evidence is very, very strong. In fact, I would challenge anyone to find a study that showed one of these foods wasn't good for you, one of these categories of foods. By the same token, we have the red box foods. So those are foods like processed meats, red meats, added sugar, refined grains. I'll go into some definitions. But there's broad consensus that these foods promote disease. And I'll show you lots of evidence for that. Now, what gets really interesting are the yellow box foods. I don't know how well you can see these. Poultry, fish, eggs, and dairy. So the interesting thing about these foods is you can find lots of studies that show a benefit to these foods. But it's usually when you compare them to the foods in the red box. If you compare them to the foods in the green box, they tend to kind of pale in comparison. And yet, where most of us spend our time and our calories is in the yellow and red boxes. Does that make sense? So the question is not so much, is there evidence to support this, or are scientists arguing about this? They're not arguing about this. The question is really, how do we get more people to eat the foods in the green box? And that's kind of how I approach my practice. How do you kind of get people to start shifting at the pace that they're ready to shift? It's very hard to change behavior, right? Things that we've been doing for a long time, it's hard to change. But how do we get people to start shifting towards those green box foods? So just to go through some definitions. So what's a processed meat? Well, a processed meat is any meat that has been cured, smoked, salted, fermented, or has added preservatives. So some tangible examples are foods like bacon, hot dogs, bologna, sausage, salami, pepperoni, ham, and then even the cold cuts and the deli slices, those are all considered processed meats as well as things like chicken nuggets. So this is from the scientific standpoint. These are all considered processed meats. So a red meat, most of us think about beef, but it also does include, scientifically, pork, lamb, goat, veal, venison, foods in this category. Added sugar is pretty self-explanatory, right? We get most of our added sugar from sweetened beverages, but we do get a lot from processed foods as well, and it's in all kinds of hidden places like ketchup and places you wouldn't imagine. And finally, refined grains. So much confusion about this. What's a refined grain? Well, it starts out as a whole grain, and it gets stripped of all of its fiber and its nutrients. So here's how it works. You have whole grains here listed on the right, and those contain these three components, a bran, a germ, and an endosperm, and what they do is they actually remove the bran and the germ, and what they're left with is a very nutritionally deplete food that doesn't have the fiber and the phytonutrients. So to give you an example, when you have, for example, white bread or white rolls, and you look at the ingredient list and you see something like this, unbleached enriched wheat flour. That's a refined grain, because what it is it doesn't say whole wheat or whole grain. And what they do is they remove all the nutrients and then they artificially add some of the vitamins back in. That's why it's enriched. So those are the red box foods. And this framework is so well accepted that even our Dietary Guidelines Advisory Committee, which is a group of nutrition scientists that every 5 years is asked to review all the evidence and report to the USDA what they recommend, this is what they said in their most recent report. A diet that's higher in plant-based foods, which is the green box foods, and lower in calories in animal-based foods is not just more health-promoting, but it actually has a less environmental impact than the current US diet. If you prefer a simpler version, you can look to writer Michael Pollan, who says, eat food, meaning real food, not too much, mostly plants. So let's talk about what are we actually eating now that we know kind of more or less what we should be eating. What's the top source of calories among kids and adults in the United States? Any guesses? Good guess. It's on the list, but it's not number one. Juice. Also a very good guess, but not number one. Pasta. Getting closer. All right, grain-based desserts. Your cake, your cookies, your pie, your sweet rolls, pastries, donuts, okay? These are, right off the bat, we've got a lot of red box foods in there, right? We've got refined grains, and we've got added sugar. We probably have some butter in there, so yellow box food. Number two, similar, bread. And we're not talking about whole grain breads here. We're talking about refined grains. All right, number three, as many times as I've given this talk, nobody has ever guessed number three. So let's see if Hamilton can have a winner in the audience. Ah, very good guess, whoever said dairy, but it's not dairy. All right, a couple more guesses. Cereal? All right, it is chicken. I was shocked when I saw this. We eat a lot of chicken. In fact, we eat 1 million chickens per hour. And It's a really amazing. So this is just to show, you get the sense already, what I said before, most people spend their time in the yellow and red boxes. So far you can see that, right? There's not a lot of green box foods in there yet. So number 4 is whoever said soda, sweetened beverages. And number 5, also in a category unto itself and a little bit shocking, pizza. Looking at it another way, what we've got is, we're 25% of our calories are coming from animal-based foods, 63% are coming from added sugars, refined grains, and oils, and only a little sliver, 12%, is coming from those green box foods. And of those, half are not in a healthy form. So it would be like almonds in a candy bar. So really, it's just 6% of our calories are coming from the most healthful foods on earth. You can see why we have a problem. You're going to hear me talk a little bit, not a little bit, you're going to hear me talk a lot about something called a plant-based diet. And I want to just demystify right off the bat what that means. Basically, a plant-based diet essentially means you're eating whole grains, beans, lentils, peas, fruits and vegetables, nuts and seeds. And those are the basis of your diet. You can either be 100% plant-based, or you can sort of move along the spectrum and be mostly plant-based. But the more you move towards that type of eating pattern, the evidence shows that the more benefit you get in terms of your health. So in fact, people who follow a mostly plant-based eating pattern, studies show, a wealth of evidence shows, that you can actually prevent every condition on this list. And in many cases, you can reverse them as well, once you already have it. So, when I talk about changing what you eat, this is what I'm talking about. I'm talking about moving along the spectrum from wherever you're starting at, which we're all starting at different places, towards a more plant-based diet, more green box foods. And when you do that, I'm going to cover 7 key things that will happen. So number 1, you're going to reduce inflammation in your body. So what's inflammation? Well, sometimes inflammation is normal. So you're running down the street or you're running to catch a flight and you sprain your ankle. And your ankle gets swollen and hot and red. That's completely normal and that's appropriate. Your body should do that because that's part of the healing process, bringing white blood cells and other healing sort of natural chemicals to the site. It'll go away on its own. But what we commonly see and what I see in my practice all the time is something called chronic inflammation. This is not normal. This is that same process of white blood cells and inflammatory chemicals, but it doesn't go away. It stays for years and years and years. And it's kind of like, you can think about burning embers on a fire, just simmering for a long time. So this is both a byproduct of many diseases, and it also causes disease. So we know we can measure it in blood tests. The most common one is one called the CRP, and maybe you've seen a doctor that's tested that. And what we know is the higher your level of CRP, the higher your risk of having a heart attack or stroke. That's very well correlated. And so it serves us to kind of keep our inflammation levels down. And the great thing is, we can do that through changing our diet. There's a number of studies looking at this. This is a review of 46 published studies, sort of a systematic review, that showed that people that tend to follow a meat-based or a Western-style eating pattern consistently have higher levels of CRP in their blood, higher inflammation. Whereas people who eat more of a plant-based diet, more fruits and vegetables, more beans, more whole grains, their levels are nice and low. And once you change your diet, you can actually lower your CRP. I've seen it in my practice quite a bit. It's a very powerful thing when it comes to your diet. And this ties into number 2. Number 2 thing that will happen when you change what you eat is you will actually dramatically lower your risk of heart disease. Your risk will plummet. So I think a lot of us, and actually many physicians, were all taught to think, heart disease is a natural consequence of aging. And as we get older, it's kind of normal to need to take several medications, or, we know heart disease is the #1 cause of death, so we figure it's just very common. It's just that's what happens to people. But the reality is, in countries that follow Western-style eating patterns, heart disease starts very young. So in this review of US soldiers who were killed in action in Korea, Their average age was 22. And when they did autopsy studies on 300 of these young men, they found that 77% already had significant blockages in their arteries. They already had heart disease. 22 years old. And studies since then have shown that actually as young as the age of 10, kids already have fatty streaks in their arteries. And that's a direct product of our lifestyles. So it actually starts very young. If there's anyone in this room who's older than 10, we've all probably got the beginnings of heart disease. And so for most of us, it's not just about preventing it, it's about actually reversing it, which I'll show you is possible. And this is as opposed to parts of the world where they eat a diet like this. What does that look like? It's mostly green box foods. And in parts of the world where they eat like this, it's actually very hard to find heart disease. Even when you have two people who are the same age and you do autopsy studies, you see huge differences. There's just not a lot of plaque or cholesterol buildup in the blood vessels. Same thing for the blue zones. These are parts of the world where people live, the highest concentration of people living to be 100 or more. Here's what they all share in common, these 5 parts of the world. This is what their diet looks like. It's filled with plants. Where they have meat, eggs, cheese, poultry in their diet, those are condiments. They're on the side, or they're used for special occasions. And of course, they have very few highly processed foods in their diet. So thinking back to those red box foods, what does the evidence actually show? So starting with red and processed meat, these are extremely closely linked with heart disease. And this is a review of all the literature that's been published around red and processed meats, showing that in all categories of different heart disease outcomes, you see an elevated risk. And it's particularly potent for those processed meats that I mentioned earlier. And it doesn't take much. So you see here it says per 50 grams per day. Well, in regular English, that's like 2 slices of ham or a few slices of bacon per day. So it doesn't take much to increase your risk, for example, of CHD, coronary heart disease, by about 40% with just that small amount, a small dose. Similar for refined grains and added sugar, and I think this is something that's been underappreciated for a long time. So refined grains increases your risk of heart disease significantly, as do added sugars. So none of these really have a role in a healthy diet. Now, what is so powerful about these plant foods to reduce our risk? Well, we know from studies like this, which this is about 200,000 people followed for 8 years, and what they found was that every single daily serving of a fruit or a vegetable lowered a person's risk of heart disease by 4% over 8 years. So if you just had one fruit or vegetable, which is not a very high bar, you're already lowering your risk. Imagine if you're in the highest category, you're eating the most fruits and vegetables, your risk was about 20% lower. It's extremely effective. We don't have a drug that can do this. There's no drug that can do this. So we talked about fruits and vegetables. Nuts and seeds are extremely potent at reducing your risk of heart disease, as are whole grains. When you shift into eating grains in their more whole form, like oatmeal or brown rice, that protects you tremendously from heart disease. And if you take your whole eating pattern and make it more plant-based, you get tremendous reduction in your risk of death from heart disease, up to 29% lower chance of dying from heart disease if you shift into that kind of an eating pattern. So one of the key reasons that these foods work has to do with cholesterol. Now, I want to be very clear. We need cholesterol. Our bodies need cholesterol. We need it for cell membranes, to make hormones, and a lot of other functions. But we don't need to eat it. Our body is capable of making all that we need. So what happens when we have extra cholesterol sort of swarming around in the bloodstream is your body doesn't know what to do with it, and it starts to deposit it in the lining of the blood vessels, and you get this little hump, like you see here. That's called a cholesterol plaque. And what that does over time is it starts to block off the blood flow. The other thing it can do is it can rupture, and that causes a heart attack or stroke. Now, because we have blood vessels all over our body, it's not just our heart or our brain that's affected by cholesterol plaque buildup. It's our limbs. It's our backs. Low back pain can be related to poor blood flow. And it's erectile dysfunction. That's very closely related to poor blood flow from cholesterol plaques. A lot of people don't realize. So there's different types of cholesterol that you can measure in the blood. And to keep it simple, I'll just tell you that we want to keep the first three as low as possible. Your total number, your LDL number, and your triglycerides. We want all of those to be as low as possible. So the foods that you want to avoid to keep your cholesterol low are shown here. So I'll start with saturated fat, foods that contain saturated fat. Those are the foods that actually tend to drive up our cholesterol the most. So that's meat, poultry, fish, eggs, dairy, and of course coconut products and palm oil, which a lot of people forget. In fact, the number one source of saturated fat in the average person's diet is cheese. And that's because we eat a lot of cheese, and also cheese is 70% saturated fat. So that's very good at pushing up your cholesterol. Cholesterol itself is only found in animal foods by definition. Plant foods don't have any cholesterol in them. And those do contribute to your blood cholesterol, but not as much as the saturated fat. It tends to be irrelevant because they kind of go in together in the same foods. Trans fats, the third column down, well, these are types of fats that are found in a lot of the processed foods. And anytime you look at a food label and you can read on there that it says partially hydrogenated something oil, that's a trans fat. And these are among the most sort of heart toxic things on the planet. These are foods types of things that we should absolutely avoid because we know that they not only directly raise your cholesterol, but they make those plaques more unstable and likely to rupture. And finally, refined grains, so sugars, white rolls, white bread, pastry items, all those foods tend to drive up the part of your panel that's called the triglycerides. So for the good news, I'm going to talk to you about fiber. So it's not a very sexy word, but it's very effective. Fiber is only found in plant foods, and it's extremely good at lowering your cholesterol. And that's because it kind of, not only if you're eating a lot of fiber, you feel so full that you're not going to eat the other foods that raise your cholesterol, but it also soaks up cholesterol inside your gut, and you get rid of it. So if you have high cholesterol, or you're trying to keep your cholesterol as low as possible, which you should, a great thing to do is have a bowl of oatmeal in the morning, old-fashioned oats, tons of fiber, or have a bowl of bean soup once a day. You're getting tons of fiber that way, and it helps lower your cholesterol. So again, if you push yourself along the spectrum and you eat in a more plant-based way, studies show you can actually reduce your total cholesterol and LDL cholesterol by about 35%. And guess what? That's about the mileage you would get from a typical statin drug, which probably the number one drug that's prescribed in the United States is the class of drug, is a statin drug. So now I've changed my practice to the point where when I see a person with high cholesterol, the first thing I talk about is, let's talk about what you're eating. And I've seen people lower their cholesterol 30 to 40% right off the bat with changing their diet. It's extremely effective. So the other component to preventing heart disease is your blood pressure, because that has a huge role in heart disease. And again, the same theme applies. There are certain foods that are very, very good at keeping our blood pressure low, and those tend to be the green box foods or the plant foods. And the rest of the foods tend to either be neutral or raise our blood pressure. And when you look at people following different eating patterns, going from omnivore all the way down to vegan, which is, of course, a 100% plant-based diet, you can actually see dramatic reductions in your risk of having high blood pressure. You're actually 63% less likely to have high blood pressure if you're eating plants. And that's even when you adjust for body weight, which is an important thing to adjust for, that relationship persists. It's extremely powerful. What about looking forward in time? Well, this is a study of about 190,000 people followed for 26 years. And what they did is they said, let's see, what is your chance of getting high blood pressure? You're starting out normal, your blood pressure's great, we're gonna follow you for 26 years. And we're gonna look at, do these foods, red meat, poultry, and seafood, affect your risk of getting high blood pressure? And what they found is, if you compare one serving a day of red meat, poultry, or fish, compared to people who eat that less than once a month, there were dramatic increases in the rates of high blood pressure over time. Most dramatic for red meat. So you can see there was about a 30% increase for people eating red meat daily compared to less than once a month. But these researchers were shocked when they saw the relationship with poultry or chicken, and even with seafood, which most of us think of as a health food. And this was independent of how many fruits and vegetables you were eating, and how much you weighed, and how much you exercised. The researchers controlled for all of that. Now, what if you already have heart disease? What if you're someone who's taking medications, you were told you've had a heart attack before, or you have significant blockages? What can you do about it at that point? Well, it turns out that there's a lot you can do about it. And one of the most amazing studies ever published is by Dr. Dean Ornish. Has anyone here heard of Dr. Ornish? Okay, great. So Dr. Dean Ornish asked this question over 20 years ago now. He said, I'm going to take people with really, really bad heart disease. The blockage is so bad that they try to walk across the room and they start getting chest pain. And I'm going to divide them into two groups. One group's going to follow what the American Heart Association says we should eat, which is lots of fruits and vegetables, beans, some low-fat dairy, and some lean meat. Half the group's going to eat that. The other half is going to eat a plant-based diet. They're just going to crowd out all the other foods with a wealth of whole grains, again, beans, fruits, and vegetables, and let's follow them for 5 years. Right off the bat, he noticed chest pain got worse, 186% worse in the American Heart Association group. Whereas in the plant-based group, they got better within a few days because their blood vessels started to function better. Second thing he noticed is that cardiac events like heart attacks and other being hospitalized for chest pain was much more common in the American Heart Association group. And the most stunning thing of all is he performed angiograms, so he could look at the insides of the blood vessels at the start of the study and 5 years later. The group on the top, the curve that's going like this, that's the American Heart Association group. Their blood vessels were just getting smaller and smaller because of all the plaque that was building up over 5 years. Compared to the plant-based group on the bottom, not only were they not getting worse, but their blood vessels were opening up. The plaques were regressing. The plaques were going away. It is really phenomenal. And in fact, he's reproduced this in so many people now that Medicare will actually pay for his program for people with heart disease. And it's extraordinarily effective. Okay, so that was number 1 and number 2, inflammation and heart disease. Number 3 is you're going to give your microbiome a makeover when you change your diet. So what is that word? What is the microbiome? Well, the microbiome is actually the trillions of microorganisms that live in our bodies, most of which are in our gut. And this is something I don't even think I learned about in medical school, and it's an area of very intensive research right now. And what we found is that these microorganisms, these trillions, they outnumber us, our own cells. These trillions of microorganisms actually are extremely responsible for our health outcomes. So they help train our immune system. They make vitamins. They help protect the lining of our gut wall. They prevent cancer. And so it turns out the food that we eat actually can shape the type of bacteria that we have. I'm going to give you a good example. Researchers a few years ago did this landmark study where they took people and they fed them foods that were high in something called choline. And those are foods like steak, eggs, and cheese. And what they found is that when we eat choline, our gut flora, our gut bacteria, will convert it into a compound called trimethylamine, which then gets further converted in the liver to something called TMAO. TMAO is one of the most toxic substances on Earth. This substance has been directly correlated with heart attacks and strokes and early death. In fact, a study comes out probably every week or two about TMAO. And so you can see that it's not just the food that you eat It's actually how that food interacts with your gut bacteria. So here it's kind of like a double whammy. You ate these foods, we know they probably weren't that good for you, and then on top of that, your gut bacteria made this toxic substance. Well, the researchers said, well, let's see what happens if we take a bunch of vegans and we feed them a steak. Presumably, they paid them something to do that. And after those vegans ate the steak, they did blood tests to look for how much TMAO they made. Barely any. In many cases, none at all. So what they found out is vegans just didn't have the same gut bacteria. They didn't have the gut bacteria that made this toxic substance. So there you have a double benefit. So this has really revolutionized the way we think about food. And I always